Okay. So what is your understanding of what's happening with the cancer and the liver disease and so forth?
Well, basically, I'm understanding that, according to what I'm seeing here, is, what can I say? My liver is not functioning that well anymore. So now, obviously, I got to go ahead and I was thinking to go ahead and moving forward with the treatment. But now with the message I got from you guys, you feel that it's not safe at this point where my liver is at to even move forward with any type of chemotherapy or radiation therapy. So,
yeah. So that's for the most part correct. The thing is, your liver function is quite poor. You're like very, very borderline. Where if we provided treatment, I'm a liver surgeon and I cut parts of the liver out, and you're not a candidate for that because your liver would not tolerate that. In terms of treatment to try to shrink this down, to potentially make you a transplant candidate, those type of things, it would be a catheter-based therapy. They go into the groin and direct the catheter up in your liver and give you radiation beads or chemotherapy beads. And the problem with that is that your liver function has to be pretty good in order for you to tolerate that.
okay.
And your bilirubin, which is your bile level in your blood, is 2.8, the last figure that we have. And generally when it goes above 2, you're at a much higher risk than someone who has normal bile level, which is 1. So
Okay.
you're 2.8 times normal.
2.8 times the normal level it should be at, I take it.
Yeah. Mm-hmm.
Okay.
Yeah, normal level of bilirubin or bile level is 1, and yours is 2.8.
Okay. So at that point, I mean, am I taking it the only thing I can really do is just try to eat healthy and just do what I'm normally doing? Because I'm sure you took a look at my record. I mean, basically what I'm doing is I'm doing the cannabis extract oil. And that's why one of the reasons, and I'll be very upfront with you, that's why was one of the reasons that I was hesitant to do any type of radiation or chemotherapy, because of the fact of where it was at. And one, I mean, everything just happened kind of odd that the radiation therapy department was not there for the first time, and I just started to have second thoughts. You talked to me about going ahead and going into the groin area, but you're also sharing with me that my liver is not functioning good enough to go through that procedure. I've also been told that my liver is too far advanced, that, as you had shared with me, that not even actually considering to, let's say, take a portion off and let it grow back is a possibility.
Yeah, that's not possible
Right.
at all.
Right.
Yeah.
So,
And that's one of the most aggressive treatments that we can provide. And if your liver was healthy, then yes, we could, technically it's feasible, but your liver, I would kill you, essentially, if I did that procedure.
right. And I appreciate for you being so honest with me at that point, because at first that was one of the biggest concerns I have. Let me ask you this, if I may, okay? Did you mention Thorazine? Is that the correct medication that I thought you had mentioned on the message that you left?
No, I haven't mentioned any medication. The medicine that is used for treatment of liver cancer is something called sorafenib.
Oh, okay. So, sorafenib.
And the trade name for it is Nexavar.
Okay. So is that in a liquid form?
No, it's a pill that you take twice a day. The thing is, your liver function is pretty poor, so your dose would need to be reduced.
Yeah.
So you need to get half the dose.
And what is the purpose of this medication?
The purpose of the medication is to try to stun the tumor and prohibit it from growing and spreading.
So it's pretty much what I'm trying to do with the cannabis extract oil.
It is. I don't know. I would say that the cannabis extract oil has not worked because compared to your prior scan, the tumor exploded. In the prior scan, the tumor was very, very small, and right now it's huge. So
Yeah, but my question would be to you, even though, let's say I did not go through any therapy and I was not taking nothing at all, would have not the tumor grown regardless because it's been 6 months now?
Yes, but it doesn't grow. Everyone's tumors grow at a different rate.
Right.
So it's unclear whether this was what, I don't know what the effect of the cannabis extract oil is, but certainly we know that it's not working.
Okay. Are you talking in my situation or in general?
Well, in general, there's no data to say that that works.
Right.
There's not been a trial. They're all anecdotal reports, right? One patient tried it, miraculously, it's gone. That type of stuff. And while that's great for that particular patient, it's not something that can be generalized to everyone.
Yeah, I understand where you're coming from, and that's my biggest debate with the whole University of Washington. I could go ahead and go down the same road with your chemotherapy and your radiation therapy, and that is
no, it's not. It's not.
Well, and that is one of the main reasons that I decided not to go with your guys' procedure, because of the fact that the cannabis extract to me is more of a natural or form that comes from a plant. It's not something that's being generated out of a pharmaceutical plant, which I'm really concerned with, because if let's say I would have went and not used cannabis and went on these pharmaceutical prescriptions they were giving to me, I'm really afraid that it would have did more damage to my liver than what I'm dealing with now. But that's my own personal opinion. So I guess my question at this point is, how much is this medication really going to help me, or am I better off just choosing my own path and go ahead and trying the extract? Because I'm really confused with the medication as far as what it's actually going to do for me,
Right. So then I'm not trying to be confrontational at all.
Right.
So, I'm not the provider that you talked to before.
Right.
That's my partner. He's out of town. That's why I'm calling you.
Right.
Okay. You met with Dr. Raymond Young.
Yes, I did.
I'm James Park, so I'm a totally different person. But
right, I understand.
Regardless, and I'm not trying to sell you a drug or have you take a drug or anything of that nature, just so you understand. The medicine is not perfect by a long stretch. It provides improvement of survival by about 3 months. Okay, that's all that it does.
Okay.
So, and it has some potential side effects. It can cause skin rashes. It can have stomach upset and things like that. The thing that's different about that medicine and the medicine that you're taking right now is that medicine has been tested in 2 multi-institutional randomized trials that enrolled several hundred patients. The one out of Europe in patients primarily with hepatitis C and alcohol cirrhosis that have liver cancer. They looked at 600 patients. 300 got the drug. 300 got a pill that looked exactly the same, but it was just a sugar pill, a placebo. And when they studied those patients, those that got the sugar pill lived about 6 to 8 months, which is what is expected. And those that received the drug lived about 10 to 11 months. So there was about a 3-month advantage in survival.
Okay, so basically, right.
Right. It's definitely not a cure. We're not saying that it's a cure. We're not saying that that you should take it. In your case, because of your liver disease, the dosage that you need to take has to be halved. Okay? It doesn't mean that if you halve the drug, you get half the benefit. It doesn't necessarily work that way, but one can only imagine that, if it's a drug that's only going to give you 3 months survival benefit, it probably won't do a whole lot if you have to dose. And there are still potential side effects even when you have to dose. So that if you wanted to pursue that route, that would require for you to sit down and talk to a medical oncologist about whether it's worth doing or not.
Okay, that's what the medical oncologist is for. I see.
Yes.
Okay. Well, I really appreciate your time and your honesty, I don't feel that you're being confrontational at all. Yeah, everybody has their own beliefs. I'm sure you understand where I'm coming from, Doctor, because I just came back from Barcelona. I sat down with a Dr. Pedrasso, who is actually an MD in action in Portugal, and he also has his license to take care of the people in Spain that they are using the cannabinoids and what have you. You know, I also met with some of the people with Dr. Cristina Sanchez. That's why the only reason that I am trying to find alternative routes, not to make it difficult on the medical community, but to look at all the options that I have for myself and my family.
Yeah, and that's totally fine. As long as you understand and you're informed in terms of what the medicines will do for you,
right.
On average. Not chasing after anecdotal. I mean, we all, you know, when I provide surgical care to my patients, yeah, are you going to have a patient that we're going to cure? Yes, of course, but that's not the expectation for this disease.
Yeah.
The expectation is that the survival will get significantly prolonged. We start talking about 5-year survival or, you know, 50-75%. But half of the patients will recur. And you know, the patients ask, well, why do you do the surgery then if you're going to tell me that half of the time I'm going to recur? I tell them, well, you'll be alive at 5 years to have that recurrence, or otherwise you won't.
Yeah.
So it just requires a meaningful discussion in terms of what the therapy is going to cost you, not just from a financial perspective, but what damage it's going to do, what type of side effects it has, and then what potential benefit it has for you. So if you've had that discussion with Dr. Sanchez or whoever it is about the cannabinoids and you feel comfortable, then that's fine.
Let me ask you this, because I haven't got an answer. Is there any way I can find out what stage of cancer I'm at this point?
So for liver cancer, you know, we have different types of stages, and the stage is not necessarily like 1, 2, 3, 4, and therefore you're XYZ.
Right.
There are 7 different stages based on the type of country that you are in. So because you said you were just in Barcelona, the Barcelona Clinic for Liver Cancer has their BCLC staging system, you know, stage 0 to A, B, and C. You would be categorized somewhere between B and C because of your poor liver function and because of the disease, how it's very infiltrative and starting to get into the portal vein.
Okay.
So it's pretty advanced.
Right. So in the U.S., what stage would I be considered at?
Well, the U.S. Still uses the BCLC staging system, but we also have what's called the AJCC TNM system. Based on that, we do it based on the tumor size, whether it's less than or greater than 5 centimeters. Yours is greater, and whether the vein is involved or not, and you're good.
Okay.
So that's how we stage it. But again, you know, the staging doesn't tell us how it should be treated necessarily, because the staging is very, very different.
Right. Well, okay. Well, that gives me a good idea where I'm at. You have been very thorough with me. You have answered a lot of questions that I have not had answers to, and I was hoping to hear them. So I greatly appreciate it.
Phone call was helpful.
Yes, and I did record this so I can go ahead and have my wife listen to it, okay? Because I think it's important that she also gets to hear what I plan to do and what have you. But we do appreciate everything, and God bless you, and you have a wonderful day.
Yeah, you too. Take care.
Take care. Peace.